Hello and welcome to HSM 430. For this class, we'll be discussing current developments affecting interprofessional teamwork. There are three learning objectives for today's class. The first is to discuss current drivers for the promotion of interprofessional teamwork, and then we're going to describe some strategies in which to do interprofessional collaboration, and then finally discuss the concept of a patient as a professional role in interprofessional collaborative practice. So, starting with the current drivers of IPCP, one of them would be quality and safety, and the need for effective collaboration and communication has been seen as something that is very central to improving the quality and safety in the care of patients. And the ways in which interprofessional teamwork contributes to an improved quality in patient care is in reducing the complaints of patients, in increasing patient satisfaction, and in reducing stress or burnout that professionals may experience, as if they were all doing this all by themselves and not having a opportunity to trade ideas or opinions. They may feel that they are carrying everything in, therefore opening them up to feelings of burnout. So, according to the 2004 report by the Institute of Medicine, it says that in order to identify errors in patient care, each member of an interprofessional team needs to know their own responsibilities as well as those of other team members, and this may require them to temporarily fill in if one team member is unable to fill in their role. So another driver of interprofessional teamwork would be media coverage, in the way that media has, media reports of those adverse care that happen as a result of poor interprofessional teamwork has brought to light some of the ways in which things that can happen if interprofessional collaboration is not paid sufficient attention to. An example would be in the Netherlands in 2009, the Dutch news reported a couple of problematic care that was delivered to cancer patients, and reported that this happened as a result of limited coordination and communication among the oncology team. Then in the US in 2008, there was a report in which a nurse described being belittled by a physician because she paged him in the nights for what he thought was a seemingly non-urgent case, which then led to, affecting the mood of the care team. And then in the UK, and this happened in 2001, there was a report that was made about the deaths of some babies that were undergoing heart surgery. And when this was released, there was an investigation that was launched. It found that while some of the surgeons in the team had considered themselves effective team players, the colleagues, the other part of the interprofessional team, had a different opinions about what they are doing in the team, and some of this had contributed to the outcome, the disastrous outcome. So while these incidences are typically rare and don't happen very often, and even when they do, they are generally a reflection of a more systemic failure, not just in interprofessional team. That's not to say that the poor teamwork within the interprofessional team is not a part of the things that are contributing to the problem. So it's still important to pay attention to having good coordination and collaboration. So another driver of interprofessional teamwork would be rural care. So, in any setting, whether it's a high income country or a low income country, delivering healthcare in rural communities presents quite a number of challenges. One of those is that it's quite difficult to recruit healthcare professionals, especially of varying specialty. And even when they have been recruited, retaining them, getting them to retain their jobs, and can become a challenge in itself. And this is, adding to the fact that because rural areas are usually vast and geometrically remote areas, coordinating care among an interprofessional team can be quite challenging. And this is, when you consider all the time that will be spent on meetings and how that hinders it because of the geographical area, and also ways of getting from one place to the other. And even though we have the internet, it may not always be reliable depend for everybody. So that does put in some difficulties. So what this then does is that it restricts opportunities team members have in order to interact often among themselves, which then affects the ability to coordinate and to collaborate as often as frequently as it needs to, or as intensely as it needs to. So there is also the issue of there being a shortage of professionals in rural settings that are working in special areas, in specialty areas, and you may find some professionals doing work that is outside what they have been primarily trained or specialized in, which can cause some challenges as a result. So, having looked at these drivers, let's just get into the interprofessional communication. So, there's a lot of communication that happens during care delivery, and coordinating the efforts of all the unique individuals that are in the team. It does come with a lot of challenges, and one of there being that because interprofessional teams depend on one another to be able to provide appropriate health care as a means of achieving the health outcomes. Each member is coming into the team with a specialized knowledge and experiences that all are important towards helping the team make informed healthcare decisions. However, finding ways in which all of this specialized knowledge is to be shared, it can be quite difficult to accomplish. For one thing, even in circumstances in which each team is sharing their specialized knowledge effectively, and each team has been provided with the latest relevant health information, there's really no guarantee that the team members are going to cooperate towards the delivery of care, even though everybody has been, put up to date with everything that is being known. The reason being that each team invariably is going to have their own interpretation of the health information that they have received, and are likely to make different decisions that will depend on the priorities that they are placing on certain care, or what they believe is the best course of action. And this could be based on their unique background and expertise, as well as what they perceive to be their involvement in the case. So all of this come into play in being able to reach a mutual decision and having to make an informed decision. So all of this does present some challenges to it. And this is not to neglect the fact that patients may have their own unique perspective on the treatment. So you may have the interprofessional team after a lot of back and forth coming up with a shared decision, and the patient says, I don't quite agree with that. And then suddenly they have to go back and come up with something else that is going to work for the patient. So this communication and interaction does come with its own challenges. So, the way of understanding how the team works is by looking at it from the perspective of team roles. So, among interprofessional teams, people are typically either filling one or two roles. You have them, either filling in the role of leadership or filling in the role of followership. So for the leaders, they exert influence over the activities of the team, and they do that by providing guidance to the team as in a way that they are meant to accomplish whatever specific goal that the team chooses to accomplish. Before, in order for them to do this, to influence the care delivery, they do require the followers to follow their directives and to trust them, to trust the decisions they are making, and to feel confident in their ability to make the right decision. So whether you are filling in a leadership role or a followership role, there is the added um, there's the added skin of whether it is a functional role or a dysfunctional role. So you have leaders and followers either filling in one of them with the functional roles. What they do is typically helping the team achieve its goals. Dysfunctional roles, on the other hand, what happens that they end up distracting the team from reaching their goals. There is a third role, which is a type of functional role, being the maintenance role. The maintenance role, what they do is that they help in establishing and preserving a good interpersonal relationship and encouraging team members to cooperate with one another. And this may have them expressing support for decisions that are made, encouraging other members of the team to be cooperative, or in a case where there is a member of the team that is being dysfunctional or filling a dysfunctional role, making comments as a way to reduce the tension that may be rising. So dysfunctional roles can limit the progress of a team, and this includes maybe members of the team being aggressive or having blocking behaviors, such as making hostile comments or refusing to respond when members of the team makes a request. And so in order to improve the working of the team and to improve the care delivery process, it's really important to minimize the dysfunctional roles, because not to do otherwise is to risk them reducing the team effectiveness. So conflict resolution is, as you can imagine, is just one of those things that are going to come up as a result of being a part of an interprofessional team, because of all the interdependence and integration that happens. It is just something that is to be expected. So conflict can come in various directions. It could be administrative, in the sense of how to work for everybody to work within the team, and it could come from scheduling meetings. A solution would be to have a standing weekly or bi-weekly meeting schedule that takes into account everybody's agenda, also leaving room for meeting remotely. You know, because of travel demands may make it such that if everybody has to meet in person, you may end up meeting sparingly, and so for having that ability to meet remotely is always very important. And then encouraging there to be active participation, leaving enough room to share information, enough room for people to read the information that is shared, and for each member to come fully prepared to actively participate in the team meetings and in the team deliberations. Another area in which conflict can come is in having the team learn how to interact effectively within the team. So, team members are very likely going to have very different perspective on how they are going to address a health condition, or even determining what the best course of action is to be. And each team member or different team members need to be able to explain their perspective, and they need to do that in a language and using examples that other team members can understand. This is not the time to use jargon or to use medical terminologies, because everybody was not trained in those ways and will not be able to understand it. So you really have to use as much everyday language as you can, so that everybody understands what is being communicated. So other teams, it's also important that other team members need to be receptive in terms of considering the differing opinions that other team members are going to have, understanding that people are going to have various opinions that may not match with yours, and being open-minded enough to consider everybody's input. So another way that conflict can come in is through arguing the merits of different ideas. So conflicts as a whole, it's actually an essential part of enabling teams to make good decisions. Conflict is not inherently bad or good. It basically depends on how it is handled. So conflict can get team members to talk, and encourages them to express the different ideas that they have, and suggest different courses of action what that the team can consider. And what this does is that it enables the team to explore different options, and by exploring different options this way, they are able to prevent making premature decisions that did not take into adequate consideration other important perspective that should have been taken into consideration. So when even though there's a tendency to muffle conflicts or not to argue out differing ideas because members of the team may find it uncomfortable, or some members of the team may feel uneasy, it is not a good idea to encourage the muffling of conflicts. And because if it's encouraged that people don't speak up despite everything, what happens is that you will find members of the team choosing to go along with the people, whatever the people who spoke up said, as a way of avoiding arguments or avoiding conflict, and in so doing they avoid arguing their idea, or even trying to provide a different perspective to the idea, whereby you end up having the team not make a very well thought out informed decision, and end up having premature solutions or suggestions. So when team members are kind of muffled about making conflicts, what it leads to is bad decisions, and we refer to this as groupthink. So it's important that team members are encouraged to express differing, conflicting ideas, because this is the best way to avoid groupthink. There's always a way to make it such that these arguments stay healthy and they don't become functional, or situations whereby people will feel they're being cut down to size. So lastly, we are going to discuss patients as professional. So the role of patients as professional is something that has been increasingly important in healthcare, and what it does is that it helps professionals to tailor the care, deliver a care process uh, to better respond to the different needs of the different individual patients. So the patient as professional role describes patients and carers as being collaborative contributors to the management and coordination of their care. They are not just people who health service is being delivered to, they are people that health service is being delivered with. So it provides an avenue in which patient's knowledge is validated, not just that of the patient's knowledge, but as well as the knowledge of their carers or their family or their community. So it allows patients and their carers to bring their everyday experiences in living with the condition into conversations about the care process. This way, it allows for more systems thinking approach to care process. So, according to Phillips et al. 2015, it describes the ideal patient as professional as an individual who is educated about their condition, the symptoms, and they are able to articulate their health experiences. They are able to keep health records. They are able to identify a support network and a health advocate. They are able to discuss, negotiate, and decide on care plans for themselves. They do this with the clinicians from a wide range of professional backgrounds, and they are able to coordinate, if necessary, the interprofessional team. So as you can see, this is a lot of role for the patient to fill, and we call this ideal patient as professional the expert patient. I'm going to talk about being the expert patient in a bit, but just understand that this is what I mean when I talk about expert patient. So the good thing about patient as professional is that what it does is that it enables the clinician and the patient to be able to tailor their care process in a way that meets the needs and preference of the patient, and this is because they are combining their knowledge, and therefore they are more likely to achieve a more successful outcome for the health of the patient. So the expert patient, the role of the expert patient as being, having an active involvement in their care is something that is being increasingly recognized as being very essential in the delivery of healthcare. So, unlike patients who regard themselves as being dependent on the clinicians, or as I said, they are people who healthcare service is being delivered to, rather than people healthcare service is being delivered with. So, the expert patient is actively seeking information, and they make day-to-day decisions about their health, and they are working actively in partnership with the clinicians regarding their care plans. There is, as you can imagine, pros and cons to filling in the role of the expert patient. So we're going to start with the pros. So one of the pros is that the partnership, this expert's role, the expert patient, the partnership between the expert patient and the clinician is very valuable to the planning and delivering of care between the patient and the health care professionals. The reason is because they are both bringing very complementary expertise that helps give a more holistic approach to the care process. The patient brings their own expertise in living with the illness, their social circumstances, their attitudes they may have to risks, what their values are, and what their preferences are. And the patient also understands what their condition is, and working in partnership with the clinicians, they are more likely going to follow whatever treatment plan or whatever medical advice that they've been given by the clinicians, because remember, they were actively involved in coming up with those plans, so they are more invested in it and more likely going to feel a sense of self-efficacy about following it and being committed to adhering to that. But the expert patient does have some cons to it. One of it is that being an expert patient, does involve the patient challenging the clinician's knowledge, and in order to have a meaningful, exchange of ideas, as the patient is challenging the clinician's knowledge, it may require that the clinician is having to spend additional time in discussing information with the expert patient, and the clinician may not have that much time to spend on one patient, and then that may kind of lead to some constraint for the healthcare provider. Also, in a situation whereby the interprofessional care team is doing a very poor job of coordinating or collaborating, the experts patients will kind of find themselves in the middle, being the one who is passing information from one healthcare provider to the healthcare provider, and trying to make sure that the overall context of their condition is well understood, and each treatment conversation they have with each clinician is being reported to different other clinicians, and they're basically coordinating the team and trying to make sure that everybody is working towards a common goal. As you can imagine, this would be an exhausting role to follow, and meantime they have to live with the illness that they have. So that could bring its own challenges to that. Another con is that the ideal patient as professional, it requires the expert patient to have very high levels of health literacy, have very high levels of medical knowledge, and a very good understanding of how the healthcare system works. And that is just not something that is applicable to most patients. It's just a skill and capacity that is most patients do not have. And as the paper pointed out, patients generally do not have the technical or medical knowledge to contribute to decision making. So at the end of the day, there are not many people that are really filling in that role as a patient as professional. So what are some of the concerns that come in with the whole idea of patient as a professional? The first is questions about whether clinicians would have the time or willingness to support such high levels of engagement with the expert patients. And even, let's say, in the event that they do have the time and willingness, would that then not lead to clinicians having unrealistic expectations that all patients are going to have those high levels of involvement, or going to want those high levels of involvement? And should clinicians have this unrealistic expectation, would they be willing to recognize and respect the decision of patients or carers who would rather not be expert patients, and would rather have a less intensive role in their care? So this is where we end for today's class. Do remember to use the Q&A board if there's any part of this lecture that you need further clarification on, and I'm always more than happy to answer all your questions. Do have a lovely day. Bye.